But there's like a bicyclist there, so if you
That's the last thing I need on my record.
And you know what I wanted? We had this wonderful conversation. Dr. Neda is a very successful dermatologist in the Newport Beach area, and she told me not to promote her because she doesn't even want new clients. And that's what I love about you, because it's not like anything that you're promoting or anything like that. But we were talking about this mind-body connection and how everything is connected, right?
It is.
So I wanted to know, what are some of your tips? Because I know you're not a marketer, you're not going to push products, you're just going to tell me as it is.
Yeah, so I would say the top questions I get asked when patients come in is, what should I be putting on my skin? And really, that's a discussion of maintenance versus treatments. So in terms of maintenance, there's top 4 things that should be on your skin. And I know that we talked about this a little earlier.
Top 4 things.
Top 4 things.
Go on.
So number 1, big surprise, you guys, sunscreen.
Sunscreen.
So here's the thing. The reason why it should be SPF 30 or higher, and the reason is the number 1 cause of aging is oxidative stress. What does that mean? External sources of oxidative stress, meaning sunlight, causes stress, which causes free radicals to form, and those free radicals degrade your collagen. Okay. So number 1, 2, and 3, prevention.
Okay.
Right? So sunscreen.
All right.
The second thing that should be on your skin is a really good glycolic acid. Why?
Glycolic acid, even for thin skin?
Yes, especially for thin skin. Yes, because over time what it does is help build your collagen level.
Do you know I've never done that?
You haven't?
I've never done
Glycolic acid is amazing.
Oh my gosh.
It actually derived from an apple. You should do it.
Okay.
You should do it. Come see me. I'll do a little peel for you, and then we'll put you on some pads to go home with.
Okay.
Yeah, so the beauty of glycolic acid is it helps with cell turnover. After the age of 25, why do we all come in like 25, 30? Gosh, Dr. Mehr, my skin is dull. It's dull. Why? Well, because our skin isn't turning over as quickly, which means it's trapped, it's dead, and it just keeps stacking on top of each other.
So the glycolic acid will help with that.
It's exfoliative.
Promise.
Promise. It's so good.
Oh, number 3.
Number 3 is a really good antioxidant. Topical antioxidants. One of my favorites is called the Daily Antioxidant Cream, and it's a combination of resveratrol, which is
Daily Antioxidant Cream.
Yes.
Okay.
And it's resveratrol and green tea.
Okay.
And caffeine, and what it does is, or a vitamin
I like
C.
me some caffeine. Let me tell
Yeah.
Just anything.
And I like me some green tea, Starbucks.
I know.
But no cane sugar.
Okay.
What it does is it helps with oxidative stress. Remember, we said the number 1 cause of aging is oxidative stress.
Yes.
We have external sources. The number 1 external source is UV light. Secondarily, it's smog.
Okay.
The number 1 cause of internal oxidative stress is cortisol, our stress hormone.
Okay.
So when we apply a topically applied antioxidant cream, what it does is it reverses oxidative damage. So it's almost like chimigan, abru atishe inflammation.
It's like,
water
it just
on the
calms,
fire.
Water on the fire. We're doing like this Farsi translation.
Yes.
I love it. So it just calms down the inflammation. Okay, got it.
Reverses
Number 4.
oxidative stress. Number 4 is a really good retinol prescription strength.
Okay, let's talk about that. Someone that was not really a doctor, like they were like, I don't know, they're a nurse. I told them that my dermatologist had suggested that I put retinol on my face. They said, no, don't do that. You have really thin skin. You don't want it. Or no, they didn't say don't do that. They said don't apply it every night. So, what are your thoughts on that? Because I know everybody loves retinol, right?
Yeah, I mean, retinol's great. It's been around since the 70s. And why we as dermatologists love it is because it reverses the signs of aging. And what it actually does is reverses skin pre-cancer. I mean, that's amazing, right?
Right.
And so...
Really? I was not right.
60-60, what can I say?
Okay.
Essentially, the key with retinols is when you apply a retinol, you have to make sure you wait 30 minutes after washing your face to put it on.
Okay, I've never heard that before.
You've got to wait.
Chera, why?
Because when we wash our skin, we basically take off all the natural oils. Well, the problem is retinols act on the second layer of skin, the dermis, not the top layer, which is the epidermis, but the deeper layer, the dermis, where our collagen is. So when we wash our face, we take off our natural oils. And the problem with that is when we put on the retinol, it's irritating to the top layer of skin until it gets down there. So we want to wait 30 minutes, some of our natural oils come back,
Okay.
and we moisturize before we apply a retinol.
Oh. See, no one had explained that to me exactly. And I've heard about retinol all these years.
Yeah.
And I just know that when I apply it, my skin gets kind of flaky and I get sort of this imaginary beard the next day or whatever. But no one had explained that you have to do it half hour after you wash your face.
Mm-hmm. Yeah, we want some
Thank
of the
you.
natural oils. Yeah, you're welcome. I love that.
Okay.
The other key is when you said beard. Okay, so we naturally as humans have a low density of oil glands around our mouth, and for that reason, I always tell people put a pea-sized amount on your fingertip, do dab, 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 dab. So these 5 places and rub it in, avoiding that perioral area, just that circle around your mouth, because you're going to dry out.
Okay.
And so the
Which
reason
I do, but I never knew. I mean, I haven't used retinol forever, but I'm going to, because these are the 4 that. And I know you're not about pushing product.
No.
I know that you're not. You don't even accept new patients.
Well, you know.
Okay. I want to know, what are some of the most frequently asked questions or concerns? Like, what do people come in? What do they want? What kind of questions do they ask?
Okay. What I'm going to say is I'm going to turn that question around. They should be asking this question that they're not asking, which is, what else affects my skin?
Yeah.
And it's diet.
It's diet.
We just can't get around it. The body is a system.
Okay.
And if
I'm going to cut you off.
Okay.
Let me tell you why. Because I get about probably let's say 5-6 DMs a day, and people want to know my skincare treatment. And the funny thing is, I don't use that much stuff. And what I want to tell them is just do plant-based diet, nutrition. Just eat, clean yourself out from the inside.
Exactly.
And I think most people go to lasers and peels and this and that. You talk about it. You're better at it.
Yeah, I mean, those all have their place, but working from the outside in will only get you so far.
Mm-hmm.
You've got to work from the inside out. And the skin is an external organ that shows what's going on in the inside. And if you're not happy with what's going on the outside, we got to look within.
Yeah.
And when you look within, I always talk to my patients, listen, we've got to put you on an anti-inflammatory diet. Why? Inflammation is the root of all disease. Inflammation is the root of all disease, especially skin disease. They're all inflammatory skin conditions.
Okay, what causes it? What are the stuff that causes it?
So the top 3 things they should avoid is, number 1 is they should avoid dairy. Dairy is super inflammatory. It's
my number 1 enemy.
Yeah, I know. It has no place in your diet if you're really looking to look good. Number 2, grains. Grains are super inflammatory for the skin and for the body, so avoid them. Number 3 is going to be sugars, refined sugars. There's nothing as bad as refined sugars.
Poison.
That cause
it's
inflammation.
If people know
exactly
how much, what poison sugar is, they wouldn't put it in their bodies.
Mm-hmm.
It's the worst thing you can put in your body.
Yeah, and the 4th thing I tell patients is just avoid red meat. The more plant-based diet you eat, the more lustrous your skin is going to be. Specifically, I let them know if they're going to have red meat, make sure it's grass-fed, organic, free range. These things matter.
Can I tell you something? I feel like I see a difference in the quality of my skin in the last 2 months because I completely gave up eggs. Completely. And I'd given up dairy for a long time, but eggs was another step. I just went beyond it. And I started having celery juice every day, tons and tons of celery juice and cucumber juice. And I feel like that's sort of an anti-inflammatory.
They are. Both of those are super anti-inflammatories. Another really great anti-inflammatory I tell patients.
Blueberries.
Exactly. A handful of organic blueberries a day.
That's right.
So good for your skin.
Right. That's right. Blueberries. I've been doing these shakes and smoothies with celery and blueberries and cilantro and all these wonderful antioxidants in there, and I feel like my skin feels like it has a little bit more of a glow.
Yeah, it's true.
I haven't done anything,
but you worked from the inside out.
That's right.
That's what you've done.
I love it.
Yeah.
Oh, that's good advice.
Thank you.
Any other nuggets you want to share with us?
Yeah. You know what? People ask what people don't ask. I let them know. What supplements should I be taking?
Yeah.
I tell them, number 1, 2, and 3, turmeric. It's a potent antioxidant.
Okay.
Go ahead and take that. Number 2, niacinamide, 500 milligrams twice a day. It's a B3 vitamin. Not niacin. It causes flushing. Niacinamide, its cousin, decreases your risk of skin cancer by 24%. But it's great. And then number 3, probiotics. Probiotics are amazing.
Can we talk probiotics?
Let's do it.
Okay, because I had this conversation with Dr. Angie the other day, and we were talking about, I'm not a big believer in supplements. I just feel like these vitamins and
Right.
I just feel like it's just like throwing money out, and you should get all your like vitamins from Whole Foods and all that stuff.
Absolutely. You can have turmeric root, and by no means do I say you have to take a supplement for it.
Right.
I encourage patients to put turmeric on their food, to take probiotics, either in the form of kombucha or fermented, things that are fermented.
Okay, that's great. So there's like natural alternatives. Okay, so kombucha, what else?
So kombucha is a big one. It's like a Korean...
I've had it, yeah.
Yeah, so kombucha is one. Another thing is sauerkraut. So like German people have a lot of sauerkraut.
Yes.
For us, I say torshi. I mean, anything fermented.
Awesome.
Anything fermented.
Okay, so tell me about probiotics and like, in fact, I just posted my friend's probiotics line because I just want to give her a shout out.
Oh, I love it.
But tell me why we take probiotics.
Essentially what happens is, like we said, diet has a big impact on the skin because of inflammation. Most of our serotonin is, and our lymph nodes are in our gut.
Right.
And so the issue with that is when we take antibiotics or when we're stressed out, it causes our what we call dysbiosis, which is a dysregulation of our good bacteria versus our bad bacteria.
Exactly.
And if we have a disproportionate amount of bad bacteria, when we consume the good bacteria, it basically normalizes the ecosystem of the gut.
Exactly.
And that's why.
Gotcha. I love it.
Lowers
This is so good. So am I coming in for a what am I doing? Glycolic acid peel?
Anything you want.
Oh, I'm so doing it. Should we like tape it so people can see it?
Yeah, let's do it. Why not?
I love it. This is so good.
This was fun. Thank you.
This is awesome.